Hello everyone, today I will be going over mental health needs of special population. Psychiatric disorders in elderly and geriatrics. Let's go over the epidemiology. That includes dementia, vascular, Lewy body, Alzheimer's, depression, bipolar affective disorder, late onset schizophrenia, delirium, anxiety related, eating disorders, personality disorders, substance misuse, and suicide. DSM-5 for the elderly and geriatrics. Dementia consists of cognitive decline, interference with independence and everyday activities, not exclusively during delirium, not better explained by a mental disorder. Depression is depressed mood, loss of interest or pleasure, unintentional weight loss, sleep disturbances, psychomotor changes, fatigue, loss in concentration, and suicidal ideation and self-harm. Bipolar affective disorder, mania, delirium is disturbance in attention, and anxiety is persistent worrying. A treatment plan for the elderly would be medications, cognitive behavioral therapy, problem-solving therapy, interpersonal therapy, life review and reminiscence therapy, exercise, and brain stimulation, which is ECT. Next, we'll go over psychiatric disorders in perinatal and lactation. That includes depression, anxiety, and postpartum psychosis. And DSM-5 is depression, which we discussed in the last slides, and anxiety. Treatment plan includes medication, behavioral therapy, screening, and perinatal psych consultation. Psychiatric disorders in pediatrics and adolescents epidemiology is ADHD, anxiety, behavioral problems, and depression. So anxiety, like we discussed earlier, the persistent worrying, depression, like we discussed earlier, behavioral problems, which is loses temper, angry, arguing with adults, disobedience, easily annoyed, spiteful, blames others for mistakes, and intentionally annoys others. ADHD is predominantly inattentive, predominantly hyperactive or impulsive, or a combination of those two. So the treatment plan for pediatrics and adolescents is applied behavior analysis, behavior therapy, cognitive behavioral therapy, interpersonal psychotherapy, family therapy, organizational training, and medication. Now we'll go over psychiatric disorders in LGBTQ. Epidemiology, which is depression, anxiety, and substance abuse. So same criteria as the others for anxiety, depression, and substance abuse is impaired control over substance use, social impairment, risk use, and pharmacologic. Treatment plan for LGBTQ is cognitive behavioral therapy, drug counseling, medications, and interpersonal therapy. As we've seen in the last slides, cognitive behavioral therapy, interpersonal therapy, and behavioral therapy seems to be a common theme in treatment plans with all populations. Psychiatric disorders in immigrant and migrant workers epidemiology, depression, anxiety, and stress. DSM-5 is anxiety, depression. Stress is development of specific fear behaviors that last 3 days to 1 month after a traumatic event. Treatment for immigrant and migrant workers is consider protective factors, recognize culturally specific concepts of distress, normative cultural factors, and cultural humility, encourage clinicians to examine their own implicit and explicit biases, consider the many external and internal factors that influence the course of a person's life, combat psychosocial stressors, screen for trauma, inform patients of their rights, use narrative therapy and cognitive restructuring, and encourage self-advocacy and empower patients. Psychiatric disorders in African Americans epidemiology is depression, anxiety, PTSD, agoraphobia, and mood disorders. DSM-5 African Americans, anxiety, depression, that seems to be a common theme in all of the populations as well. Mood disorders does not meet the criteria of unspecified depressive disorder and unspecified bipolar disorder. Treatments for African Americans is church, medications, cognitive behavioral therapy, and interpersonal therapy.